So Angela, you're back with us today, just kind of doing a 1-year follow-up after DTR for just to evaluate and see how you're doing. And originally, your diagnosis was that of Meniere's disease, and you came to me by just kind of wanting some other answers. Is there a cause and effect going on with other things?
Right.
Because you put down quite a few symptoms on your signs and symptoms page, but I just wanted to know. Take me through since last time I've seen you, because it hasn't quite been a year since I've seen you, but it's been a year since we finished the therapy.
Mm-hmm.
So,
I think
how
it's
have
been actually a little over a year since we finished.
Oh, you know what? Because I was supposed to see you in November, and we had the snow and the ice.
Mm-hmm.
Yeah. Okay. So, how have things been?
Really good. I've had basically hardly any issues. Once in a great blue moon, I'll feel that feeling that I'm a little anxious that something's going to happen. Never manifests. Hardly any tinnitus. No vertigo, which was the most horrifying part of the whole deal. I've had no problems with my hearing. Of course, lost the original amount in my left ear, but I don't even notice it really being gone. And so really pretty much just feeling really good.
Good. Are you taking any of the medications that you were taking?
No medications at all. At first I took a water pill and potassium for just a short amount of time, mainly because I was so nervous. I will confess I do still have that at home because I get a little nervous occasionally. But I don't take anything. I don't really watch what I eat anymore, and I had lost 25 pounds because I was watching what I eat and the sodium mainly. The only thing that I haven't started back up is caffeine. I figured if I quit drinking coffee once, I should probably just stick with that.
That's a good habit to do with that, for sure. I wish I could break that.
Yeah, so, yeah, doing very well.
So, couple things that were interesting to me, that feeling in the throat, is that, yeah, in the neck, has that, still gone?
Yep, that's
no issues?
gone. No issues.
Okay, what about the headaches? You would put down temples, forehead, hair and scalp were painful to the touch.
Yeah, I would have sometimes even like, not so much on this side, but on this side and occasionally on this side I would have like even tingling and numbness and weirdness, going on. I don't have any of that. I don't have any of the pain in the front of my neck. Yeah, doing good that way. I move my neck around freely. This would have been impossible before.
Right. So when you say it would have been impossible before, what would happen when you would move your neck like that?
Well, basically, for a while the symptoms of Meniere's kind of just didn't go away. Really, I kind of felt always unstable. That type of thing. I felt like a little bit like I was on a boat all the time, and so you just become used to being very careful with your movements, not bending over too quickly, not turning your head too quickly, all of those types of things. And so it didn't necessarily always throw me into anything because I already was symptomatic, but it was just something that you learned to control, because if you're already feeling dizzy and you turn your head too quick, obviously the result's not going to be good,
Right.
So you just kind of over time get to where you're real careful with your movements, you're careful with what you eat, you're careful with all of those types of things.
Now, something that because I spend quite a bit of time reading some of the Facebook forums on Meniere's, and people who suffer from Meniere's talk about something called brain fog, and I think you mentioned that to me originally. Have you noticed any bouts or anything with that?
No.
Since?
No. I actually truly was was probably looking at the surgeries, a little bit nervous about that, but ready to just snip those nerves and be deaf rather than continue the way I was. I was worried that I was going to lose my job because most of the time I really couldn't think all that clearly at times, Take me a lot longer to do normal tasks that before would just be a snap for me in my daily, my daily work, my daily life at home, everything. And I've been very clear-headed, and that has not ever stopped, since I had the last treatment.
Now two questions, not really so much about you, but your husband. How long have you been married?
We've been married, oh gosh, almost 16 years.
Okay. So has your husband noticed a difference in how you feel and how you interact with him, like on a daily basis, now since you have been treated with the DTR versus what things were like prior?
Mm-hmm. Yeah, it's a pretty scary thing for your family members. There's a lot of frustration because you can't do normal things sometimes, or you'll be trying to do normal things and you get stopped because you're trying to drive to a game and you're so sick that because of the car motion and stuff, because you're a little off balance, you're having to stop. You don't know, any basically thing that you ever would want to do, you can't necessarily just do. My husband travels a lot, and so he got to be fearful of leaving me by myself, because a lot of times he would have to help me into the restroom, or he'd have to pick me up off the floor, or all kinds of different things like that. So it would make him afraid to go places, but he still had to do it because that's his job.
Sure.
Now he does his thing. He goes fishing now. Hunting. He does whatever he wants to do, and there really isn't that fear. It just isn't there. Period. There's never a thought that, ooh, am I going to be able to leave her, and do I call my buddy, because I actually, when he would be out, there were times when I would be having an attack, and someone would have to come.
Yeah.
It's whether it would be a friend of mine or a friend of his. So that's totally gone, and we pretty much just do whatever. He's trying to get me to go back out on the ocean, and I'm like, oh, that might be a little bit of a stretch.
Not sure you want to tackle that one yet, huh?
Maybe not. We'll see. The summer's just getting started, so we'll see.
Well, I can totally respect that. So, quite a life change for you then.
Mm-hmm. Yeah, but I'm back to myself.
Okay.
And I had lost myself completely for quite a little while there.
Glad you had it done?
Ecstatic that I had it done.
Excellent.
I would do it again and again and again.
Well, once we get you to a good place, it's going to maintain itself. But what would you have any words of advice for anybody who's out there suffering and the reason why I ask is because a lot of patients, I think, lose hope, and the reason why I make these videos and these case studies is to just let people know that, hey, there's options, and if you might not be a candidate for this, but let's take a look and evaluate. Would you have anything to say?
I would say that from the beginning of this starting to happen to me to the end, because I do feel like it was an end to the symptoms, I never lost hope, although I feel like I came close to losing hope many times. I wanted a solution, and everywhere that I went, other doctors and ENTs, that type of thing, there really wasn't a solution. There was just a management of symptoms, which really wasn't managing much, because of the symptoms still manifest regardless of what you do. You can try to lessen them, but that's about it. So I would say try, do what you think is right, not what other people tell you is right, because if I had listened to many, many different people, I would have never even tried it. I wouldn't have listened to anybody telling me that, oh, your symptoms can go away. Because everyone said, this is just it. This is the way your life's going to be. And I'm thinking to myself, well, this isn't even a life.
Right.
So for me, it was finding something that was going to work, irregardless of what anybody told me was going to work. So I would say try, and try again. And find something that works for you.
I am so ecstatic for you, because it is a life changer, and I don't care what the diagnosis is. If you have somebody that measures and will listen, I don't turn anybody away, because I can't put a value on how somebody else feels.
Right.
But if there's something that makes sense, that's not right, that can be corrected structurally, it definitely impacts other parts of the body.
Yeah.
And so I let the patient decide, because I don't turn anybody away.
Yeah.
And if I did, and I did what other doctors had done for you, which is this is as good as it gets, sorry,
Right.
well,
I wouldn't have my life back.
you would still be in the same place.
Exactly.
And I have so many cases that would be, things just sound really bizarre. And when you get the bite right, amazing things can happen.
Yeah.
So, well, I appreciate you sharing and allowing me to do a little recording to share with others. So,
Yeah.
thank you.
No problem at all. And I appreciate you. Thank you so much.
You're welcome.